Today we have with us the amazing Nyle MacFarlane, who is a integrative occupational therapist and founder of Blue Nile Therapy. They specialize in holistic manual therapies that consider the mind body spirit interplay. Nile is going to give the wellness talk and lead us through a mind body practice. By the way, if you didn't know, but Dr. Kogan and we did an episode of the GW Medical Enterprise, GW Medical. I'm having a tough time, y'all. GW Integrative Medicine podcast with Nile. And the title of that is Fascia, Trauma, and Letting Go. If you haven't listened to it, you need to listen to it after
And I
today's
guarantee you'll
event.
have some goosebumps because I
Yeah.
had when we were recording. So everybody have to listen. If you or your loved one ever went through any trauma, you got to listen to it. And pretty much everybody went through some trauma at some point. So welcome everybody. Thanks, Janet, for the intro. So let's see. I have a couple of news. So one is the new strain is causing what's called a silent hypoxia. So I'm going to have to describe what this is, hypoxia. So I just put that in. So basically, there's been multiple reports in the last few weeks of patients presenting to healthcare providers, whether hospital or not necessarily having a lot of shortness of breath, but having very low oxygen with this new variant. It's not exactly clear why that's happening. We did not see much of this with the prior strain. So it looks like the new strain is more virulent actually compared to, they kept saying that it's less virulent. However, there's some indication that between this silent hypoxia and the what's called a razor sharp throat pain, it feels to me that the strain is a little bit more aggressive than prior. Now, why is this important? Well, because silent hypoxia is very problematic, especially if it's going to last for several weeks or several months. It's definitely going to contribute to cognitive decline. It's almost for sure is part of the culprit of multifactorial increase in risk of dementia after the onset of COVID. We already have a clear data linking new cases of dementia with history of COVID or multiple COVID. And hypoxia is really, really bad for the brain for any periods of time. And especially if it's silent, you're not going to fix it until you know about it. So what am I proposing here? Well, for cost of $40, I'm going to put something in the link. You can even get cheaper ones. So this is a pulse oximeters on Amazon. There's literally hundreds of them. Which exactly one to pick? I don't know. I just did this little search. I picked this one. Why? This one is supposed to be FDA approved and also connects to the phone. So you can actually track and record your oxygen levels. So I think everybody should have a piece of equipment like this at home. It's not just good for oxygen, it's also really good for pulse. So you actually get an instant pulse measure instead of, I guess everybody now have different watches and wearables, but most of those devices will not accurately measure your oxygen. So you really need to put the system on your finger. Now, I do carry a device like this with me all the time. It's actually attached to my stethoscope. Just going to show you which one. I have really old one. They work forever. Like I think this one is already 10 years old. I'm not kidding. And this one is a bit older looking. What you're going to get is going to be newer. You just power it up. There's standard batteries. You stick it on your finger like this and you measure. And anything less than 90 would be considered concerning. Now, of course, there are some conditions like chronic lung disease or emphysema where you expect to have a lower oxygen. But regardless, this is something you want to have. Now, you also want to have this when you literally feel short of breath, like, right? So if you feel short of breath, you put this device on your finger and oxygen is low, probably you're having some kind of medical emergency that you need to go to the hospital for. So it's a very inexpensive piece of equipment that very smart to have in the house for everybody. I think I'm kind of repeating a little bit. When the COVID hit, this was one of the first things we discussed, right? We said everybody buy them. There was even a shortage of those things early on the Amazon. Now you can buy them. You can buy them as low as $10, I think. I don't know the quality of the $10 one versus the $40 the one, but still. So nobody knows what this means. They're just trying to investigate this. My presumption is when you have silent hypoxia, it means that there's some process in the lung, but it's not causing a lot of junk and it's not causing a lot of collapse of the lung. Because if that happens, people typically symptomatic, they have symptoms. So it's some kind of an impact, what sometimes described as interstitial impact, that impacts exchange of gases without causing the demand on breathing for a person to be aware of that increase in demand. So I'm sure we're going to hear more about this in coming weeks and months, and the treatment would be probably supportive mostly, and then observation, right? You want to make sure you give some oxygen. You want to make sure you try to fix why the oxygen is low, if you can figure it out. So that's that. All right, let's do questions. That's the only update I have. I tried to look up at some statistics. There are definitely spiking going on in some states, not in every state, but in many states. So I think it's it's sort of what we predicted. Now the spikes don't seem to be as heavy as the winter ones, so hopefully it'll pass and most of us will not catch this strain. The other quick news: a couple of days ago, Moderna booster got approved, so they're probably gonna get this out to public very quickly. So it looks like that this year they're doing this a little faster than what they did last year, which was late September, October, if I'm not mistaken. Looks like they're going to be ready by August by the sound of it. Yeah, so correct. That's what I think. I've also started seeing, thanks, Linda. I've also started seeing more providers in the clinic wearing masks. We've been told that there were several episodes at MFA of people being diagnosed with acute COVID right in the clinic, not in the emergency room, first emergency room. So yeah. So I have seen that. I kind of have not started doing it myself to wear a mask. I think what I'm doing is if I'm carrying the mask, but if I'm seeing that patient is fine, I wouldn't put it on. So I think I probably may need to change that to just start wearing mask again. Right. So this is a really difficult question. Believe it or not, I have seen very mild variants of this, and then I have one patient right now who's been going through about 3 years of treatment, completely not working. It's miserable, by the way, if you don't have a sense of smell and taste, because you really can't, like the food is just, we need to enjoy the food, right? So you're really not enjoying the food. There are a couple of different techniques. So there's a technique of using aromatherapy, where you take alternating very strong smells that are very different. So maybe a sweet and a pungent, or like a bitter taste and a sweet taste, and you alternate them. So, and you know what you're taking, right? Because the label tells you so. So you keep training the brain to expect a taste and a smell to come through, and they're very strong. So actually, believe it or not, that's the number one treatment, and it works. It works in most cases, but it doesn't always work. So I have one patient right now. I'm trying all kinds of crazy things, including IV ketamine injections or injections of ketamine. Well, because the ketamine is a rewiring agent, right? So there's potentially an expectation of it to work. But yeah, I don't have further answer to that. It's a great question. So no, I recommend you wait for the upcoming booster, not the one because the new ones hasn't been released yet. They just approved it, but it's not yet available for the general public. So wait until the new booster comes out. So. Right. So ketamine in COVID and long COVID particularly. We just got a grant. We just got a small grant. So we will be offering another ketamine retreat for long COVID patients. We haven't quite figured out how we're going to do this. There's going to be some research component to it. It's a small grant, but it's going to be interesting. So, because we already ran one retreat and it was quite successful. So we applied for the grant so people don't have to pay for that. Yes, right. So So right, that's one of the reasons why this patient we try to start using ketamine wasn't just it helped Stephanie, but there are other case reports where ketamine has been reported as something effective for this unusual condition. We have not seen this condition pre-COVID. It is not something that other viruses tend to do often. So you can have a change in smell and taste, but complete loss of smell and taste, that's pretty unusual. I think the COVID has a very unique predisposition for that. So, all right, well, maybe we just take a couple more minutes for more other questions unrelated to anything. Don't have to be the questions that we already discussed. Unfortunately, I have a feeling somebody asked me to present something and I completely forgot. So if you remember this, it was 2 weeks ago, so I just blocked it. So if it was you and you remember what I was supposed to cover, put it in the chat so I can figure it out. Right, that's a great question. So they're supposed to work accurately. Linda, the way I kind of generally tell people, if you don't trust your pulse ox, whenever you go to next time to your doctor's office, bring it because most of the doctor's offices have pulse oxes, and that's a commercial grade. So those are much higher quality. So you can just simply compare it. You just wear it on the different fingers at the same time, and you see that the readings ought to be close. There are two situations where they don't work. They don't work at all or really poorly if something really wrong with the heart rate, like it's really fast or there's some really strong arrhythmia. So you may not, but it will show you. There's a wave of the pulse that's on the screen. If it's not there, it's not working, even if it's reading something. So that's one. Second, when the fingers are very cold and clamped. So like if you have Raynaud's, if you're outside in cold temperature, you just walk back in, the fingers may be quite cold, it may just not pick up or it'll gonna give you a false reading. Like it'll say 70. Obviously, you cannot live with 70% oxygen. I mean, that's not compatible with living. So, but if you see something like this, obviously something is wrong, right? So then you would need to either make sure your fingers are warmed up or, that you're, yeah, so whatever, because whatever the interference is that you eliminated, whether it's a cold or something else. But usually color of the skin, I think the new devices, they read this okay. And moreover, I think in the next few years, we will start having all of the things like this, like the Aura Ring, get really accurate. Aura Ring already has it. They just introduced this as a few months ago. So now I can get pulse ox on this thing. I haven't compared it to the device I show you, to the actual pulse ox, but I presume that eventually they'll get quality of those measures good enough. Right now, it's still hit and miss, but I'm sure that wearables are exploding. I mean, wherever I look, it's a kind of I gave an interview to a newspaper yesterday about biohacking, and like for several minutes we were discussing the measurements methods, right? And so every biohacker has 2, 3, or more wearable devices for different things, and so they collect all kinds of data, and of course the oxygen level and pulse is some of the most important ones, so they get routinely collected long term, continuous monitoring. Should you wear a mask? Again, individualize your risk. Going to a large gathering, probably yes. Going to a local store, 9 o'clock in the morning, there's no one there, probably not. Think of it, Rana. Think of it as a constant change in the risk, right? So when the risk goes up, you may want to put the mask on. Because I don't think it's realistic to go outside every time to have a mask on. It's not going to be good for your mental health. It's just not gonna, so being it also will push you to be more aware. I think it's important that you're aware of their surroundings. And if somebody's really sick, maybe you don't even want to be there. Forget the mask. Mask is not 100% either, right? All right, I think I took a couple minutes out of Nile's time, but I think that's probably okay. Last question. If not, let's have Niles do the wellness and mind body. I presume we'll be getting up and moving. That's pretty much guaranteed with Niles. I'm looking forward to that. It's sitting way too much. I'm applying to associate professor, I mean to the full professor. So I have to do this horrendous application form. Thank God for ChatGPT, half of it, that's what it does. But it's so much compiling of data, and like I've been sitting for hours on end. It's tiring. So excited for a little movement break. Okay, now let's put you on a spot here, and actually I'm going to get rid of my spot.
Okay. Hi. Yes, we are going to be moving. Maybe not as much today. I actually see some folks who maybe can't quite get out of bed, and I just want to invite for those people, if they have a caregiver, can you maybe touch in different places for them? So we're going to be doing a lot more touch today than movement, but we are going to be doing a little movement. So what inspired me to offer this talk is that I've been getting a lot more people in my clinic lately who are coming in with more physical pain. And I can't help but think that's kind of related to some of the things that Misha is saying, like we're seeing COVID present differently. Our bodies are changing and morphing from this virus, and then from the lifestyle that we've had to adjust to because of the virus. So a lot more people are using virtual technology to replace in-person interactions. There's less movement happening in our bodies, so our bodies are stiffening up. And so as a result, I'm seeing a lot more people in a clinical setting coming in and saying, I have more body pain. Usually by the time people come to see me, they've tried other methods to release their fascial system and to release the pain in their body. And the majority of the reason why the work that they had done up until seeing me hasn't stuck is because they're not also addressing the emotional component. So a lot of what I want to focus on today is really this idea, and I probably focus on it in every one of my talks, but it's important, it's that important, is that there is no separation between the mind and the body. There's no separation between what you're experiencing in your physical body and the emotional pain or trauma that may have occurred in your upbringing. So somewhere in your body, you are still holding on to the memory and the emotion of your past. And we think that the reason we think that we just get over it. That doesn't happen. We may be able to mentally move past those moments, but the body is still holding those moments in time somewhere in the tissue. Yeah, and so that's really what I want to focus on today. I don't want to get bogged down in the what it's holding. I don't want to get bogged down in the why that it's holding. If you're interested in those things, please feel free to reach out to me. We can talk about it, or buy my book when it comes out in a couple of years, because all of that's in there. But what I want to focus on really today is just the where. Where are you holding? Where are you holding that memory? Where are you holding that emotion? And that's what we're going to focus on. So I'm going to go over 7 specific key areas in the body that I have observed we tend to hold emotion and memory. And I have coined those 7 specific areas or regions the embodiment codes. So what the embodiment codes are, actually, let me pull up. I have a little bit of a visual. Along with movement, I like to also use visuals because I know there are some people that are kind of multisensory learners, so having that visual experience can be really helpful. You can hear my birds in the background. I'm at the beach riding this week. Okay. So the embodiment codes. The embodiment codes came out of about a decade plus of clinical analysis, where I had started to notice that all bodies hold a variation of these 7 different fascial strain patterns in their body. So each of these fascial strain patterns are places in the body where 2 points need to be able to talk to each other by way of a fascial connection. Point A and point B need to be able to connect with one another so that the energy, the emotion can flow. Emotion is energy, yes? If we can't acknowledge that, we don't even have a starting point in today's session. Emotion is energy. Energy must move. Energy cannot be created or destroyed. It can only be transmuted. So if emotion is energy, it must be able to move through the body. When it doesn't move through the body, it's because there's a restriction in some place in the body, and then that restriction becomes a sponge for that emotion or stress. Now, where in the body has everything to do with what that emotion is. So I had, through decades of clinical analysis, I had been able to kind of map 7 different places in the body that store a specific type of trauma or emotion that we all endure just by being a member of the collective. So these are 7 collective traumas that we've all been through. Like COVID is a collective trauma. These are 7 collective traumas. I'm going to go over them now. Oh, before I do, by the way, let me just back up so you don't get lost in that. I have a favor to ask everyone, because we are going to take this into a mindfulness practice next. And the mindfulness practice we do is going to be based on what resonates with you all the most. So as I'm going through these 7 collective traumas that we store in our body, when one resonates with you, could you please write it in the chat? So you can write it as either embodiment code, whatever number it is, or the name of the code. But that means I'm going to need you to be close to the computer now so you can say embodiment code, whatever. All right. And then at the end of this run through, I'm going to look at the chat and see whichever one won, that's the one we're going to do together in the mindfulness practice. I'm going to lead you through it today. All right. Are you ready? Okay. So embodiment code 1 is the connection between the hip flexors in the front and the sacrum in the back. You can see on the slide here, those 4 regions of the body, those are the places that hold this particular trauma and emotion. And the trauma and emotion is related to desire and worthiness. So the pelvic belly, which is the place in the front, the pelvis, if you just want to kind of touch here in the front, that's kind of where your if you have a uterus or did have a uterus, that's where that would live. The bladder lives there. The ovaries, if you have them or had them, that's where they live. The pelvic belly, really that area holds safety. And then the abdomen, oh, I spelled that wrong. The abdomen, that's where we tend to hold a lot of our like worthiness stuff. Our sacrum is in the back. That's where we hold a lot of our support and kind of anchoring into security. And then the hip flexors in the front, those are very responsive to stress. So between those 4 areas, that the fascial strain there holds our trauma and emotion related to our deepest desires and our worthiness. And what I mean by that is you may want something, but if it showed up in your life right now, you would push it away because there's an issue around worthiness there. And how do we know that this code, embodiment code, resonates with us? Well, if those places in the body are tight and holding tension, then they're holding emotion too. So you can trust in this way. This is your body telling you, I'm holding something, and I'm telling you from clinical experience, it's likely related to desire and worthiness. All right, so do you see where we're going here? I'm going to do this 7 times. So as we start to get into it, you'll really start to pick up on what's happening. Another place in the body, this is embodiment code 2, is the mother wound. And these are all left-sided fascial structures. So the left side of the body is our feminine side. It's our receiving side. And this side of the body holds our mother wounding. And when I say mother wounding, I mean it can either be us as mothers, wounds that we carry as mothers, or wounds that we inherited from our own mothers. Everyone has a mother, even if they've never met their mother. And in this, in the left side of the body, we tend to hold our fascial, our wounding related to the mother. So the structures are the pancreas, which is on the left, that holds sorrow, collective sorrow. The mesentery, that is the fascial system structure that kind of anchors the organs into the back wall of the body. The left hip, the hip hiker muscle, where we hold our babies, like in this picture, we hold our babies on our left hip so we can get stuff done with our right hand, the multitasking mother. And the chest tissue, this is where we tend to hold caregiver burden. Adipose tissue is a big site for memory and emotion. So women, people assigned female at birth, have a lot of opportunity for emotion. And that's where you hear people say things like, I have so much on my chest. I feel like I need to get this off my chest, or I feel the weight of the world on my shoulders. That's that caregiver burden. With the mother wounding, these are emotions related to holding ourselves accountable for the actions and behaviors of our lineage. So the martyr mother's like, oh, they're in shock when their child does something because they just take it on like it's their responsibility to fix that. Or they can be very like nagging to other family members, like, how dare you do that? Because deep down inside, in those places in the body, they hold themselves accountable. Even though they didn't do the thing, it feels like they did the thing. So those structures, kind of the left, also the left descending colon is there. That's very much about letting go. Let go of holding yourself accountable. The healthy mother is able to let go and adapt to change. She knows that change is inevitable. So if you struggle with some of those things, it's likely you're still holding that wounding in those places in the body. Embodiment code 3, speaking of holding, is what are you holding? This is the respiratory diaphragm just below your ribs. So respiratory diaphragm controls digestion. It controls breath. Is that a big one these days? Yeah. So restriction in the respiratory diaphragm can restrict the lungs. It can also create digestion dysregulation. And that connection to the jaw. So the jaw is about clenching, holding, control, mastication. We don't realize when we're, so this code has a lot to do with wounding around feeling a need for control. So if we feel out of control, we might clench in those places. We hold our breath when we're trying to control an outcome, or when we're attached to an outcome and we don't realize it, we might clench. Also between the respiratory diaphragm and the jaw is the heart. So there can be a lot of armor and kind of guarding around this place in the body with this code. This code holds a lot around old agreements. So agreements we might have made in the past out of a need to survival, but those agreements don't necessarily age well with us. So if we find ourselves repeating same patterns that it's like we can literally see ourselves doing the same thing, and we know that thing doesn't work. Why are we still doing that? That's related to this code. Code 4 is the code for integration. This one treats our midline fascial structures. So the dural tube, which is a sheath of fascia that covers our spinal cord, it surrounds the brain, runs down through the base of the skull and covers the spinal cord and inserts at the tip of the tailbone. The dural tube is the very first thing to develop when you were being created. So at your moment of gestation, it's known as the nuchal folds. They come around and close, and then from that, the head and the tail are created, little arm buds, little leg buds. So you can see on the picture here, this is an embryo that's within the first 3 weeks of life. This is the most ancient part of you, and this holds memory through your generations. Now, when someone has a restriction or a tether in this midline of the body, they have things like tongue tie, tethered oral tissue. They can have migraines. They can have tailbone issues, tension between the eyes, which then locks into the amygdala. The amygdala has been getting a lot of attention lately as our fear center, right? So the amygdala, our deep brain centers, are our spaces of regulation, which control sleep-wake cycles, fight, flight, freeze, or fawn states, our hippocampus, memory centers. So when you have crushing pressure in the deep brain because of tethers in the midline structures, it can feel like anxiety, but it's actually tension in the cranium. The emotion that we hold here is related to not being able to fully embody our yeses and our nos. We can't stand solid in our authentic truth. We can't own our truth. So people who struggle with this, everybody's like, all of these, people who struggle with this code, they struggle with boundaries. They struggle with really showing up in their full embodied yes, or advocating for their no's. They're like, this was a no for me. Why did I do that again? Why did I say yes when it felt like a no? Or they felt the no in their body, but they keep ignoring it. That is an issue with integration. Integration is the ability to walk the talk, coming into this world knowing yourself and really embodying that. So blocks around that show up in the midline structures of the body. Embodiment code 5 is the code for balance. This is the push-pull interplay between the shoulders and the low back. So that's how that plays out in the physical body. So I see this in the clinic all the time. Someone comes in and says, I have so much low back pain, and their shoulders are crazy tight, Misha. Those folks tend to struggle with balance, right? They push themselves really, really hard, and then the bottom drops out, and they have no choice but to rest. Finding that pace in life. This also shows up. So just to speak a little more to the physicality of it, we find if someone's showing up with back pain and we release the shoulders, the back pain magnifies, because really it shouldn't be the shoulders or the low back fronting the load. It should be the core in the front. And so there's a disconnect there. There's a lack of kind of that fulcrum point, that center axis, being able to really hold the load there. And it's usually because it's busy with trauma. There's a lot of trauma in the core in the front. There's a lot of fascial restriction in the front. So the shoulders and the low back have to carry the load. And if you release one, it just shows up in the other, when really it should be coming into the front. So when we release those structures in the body, we then have to also work with the emotional piece. Okay. And the emotional piece, we almost always find for these people, that is that all or nothing kind of pendulum swing where they're like, they do too much and then they have to stop. They do too much and then they have to stop, rather than kind of finding a balance point someplace in the middle. For these folks, when balance is the issue for them, we've got to disrupt the whole system. Yeah, it's like, what can leave? Everything must go, and then what can we start to slowly add back in? Code 6, embodiment code 6, is healing your truth. And in the body, this is the connection between the levator scapula, which if you just kind of reach behind your back, I bet you probably do this all the time, and massage your neck right there. Yeah, that's the levator scap. And levator means to elevate, and then scapula. So it's the muscle that elevates and depresses the scapula. And I bet you don't even realize you're like this all the time. Your shoulders are just up. That levator scap is on. Now that levator scap muscle actually connects to the piriformis muscle, which is all the way down in the pelvic floor. the nickname for this muscle is the runner's muscle. This muscle sits behind your sacrum. So if you just kind of reach back and touch your tailbone back there, and then go a little to the left or the right, that space right there, that's the sacrum, or that's the piriformis. So that connects to the levator scap. And what that holds is emotion around your truth. When our truth is stifled, we don't feel safe. And the piriformis feels it. It's like, I gotta run. And then the shoulders feel it, and it's like, no, I gotta close this off. This isn't for anyone. I can't let anyone hear this, right? And so those are things that happened either to you, or in some cases, what I find clinically is that some people are tight there because they've stifled their own truth. That was a big realization for me. Those places in the body are tight because I'm not embodying my own truth. I've stifled my own truth. I'm not fully living up to my potential. And then the final one is Embodiment Code 7. Embodiment Code 7 is the knees, which I had this whole thing download to me like 5-6 years ago after decades of watching bodies. There's 7 fascial connections, and the 7th one was knees. I'm like, what? Okay, this is how I knew I didn't make this up. The body was showing me over and over again that the knee joint is like a holding tank for what you are waiting to receive. And so folks who are not walking in their path, they have breakdown of the knee joint because they're constantly pivoting and turning. So the knee joint is a hinge joint. Its action is designed to flex and extend. That's all it's supposed to do. And where you get breakdown in the hinge joint is when you have to pivot or turn or do a quick lateral movement. And I see this a lot with folks with immigration trauma. All right. They came to this country because their family wanted them to have a better life, but they're pulled into their culture while also trying to acclimate to American culture. So it's this like, who am I? Where am I? Where's my foundation? So this treats the muscles above and below the knee and opens up the knee joint, and then helps to release any blocks that are keeping you from facing the direction you're meant to face, finding your focus, and embodying your self-mastery. All right, so important to remember here, I want you to focus on the places in the body that were really talking to you. And if there was a thing I said related to the emotion, that trust that that's your code. So take a moment to just write down in the chat, if you haven't already, which one really stands out to you. So I knew I was going to get this. I have code 3, but they're all useful. So code 3, code 1. Piriformis, knee, low back. Okay, goodness gracious. That's what this says. Goodness gracious, all of them. 6, 1. Some of you remember the numbers. 5 is balance. 3 is what are you holding? Respiratory diaphragm jaw connection. 1 is pelvis, desire and worthiness. 6 is healing your truth. 3, I got 3 again. Respiratory diaphragm jaw connection. 1 again. Jacqueline, can you give me a number? 6 and 2. All right, y'all, if I don't get it, so far it's like it's all of them. Like between everyone, we've got 1 for each one. Let's see. Okay, so I have so far 3 is in the running, 3 and 6. 3 is what are you holding? Those old agreements. And I will tell you that one is coming up like gangbusters in the clinic lately. Like people need to clear this old stuff if we're going to step into something new. 6 is also really showing up, levator, scapula, piriformis muscle, people really being ready to step into their truth, especially with what's happening collectively lately. We won't get into politics, but you know what I'm talking about. 6 is winning. 6 is the healing your truth. my question about where my clinic is. So I'm located in Silver Spring, Maryland, and I also do virtual sessions. I'm also doing an open house on Sunday the 20th at the Journey Space in Glen Echo. You can find my clinic. Janette will put the link, and you can come join me on the 20th if you're in Glen Echo. I'm going to be doing a fun in-person clinic workshop. Okay, I think we're going to do code 6. So just to go back one, code 6. Oof, even just that picture there, y'all, holding the throat. This is healing your truth. And I will tell you, this is my white whale. And what I mean by that is, of all 7 codes, this is the one I have struggled with the most over the years, reconciling within my own system. So this one's very near and dear to my heart. I'm really excited to do this one with you. Okay, so the way we're going to do this is first we're going to identify where in the body these 2 structures are. So I'm going to show you on my own body. Let me stop share. Hi. I'm going to stand. So the levator scapula muscle, I kind of already showed you. If you just take your hand and reach it behind your back like you're patting yourself on the back, that's the levator scapula. And dig in there a little bit. Oh, is it cordy and tight? Now, as you're digging in, I bet you this is a place where you're like, you tell your partner to like, just put an elbow in there, right? When you're digging into that place, unconsciously, your piriformis is tightening up also because these 2 have a symbiotic relationship. They do talk to each other unconsciously. And why a lot of people don't get resolved when you're like, just put an elbow in here, is because you've also got to go here. So to find the piriformis muscle, you're going to find your tailbone again with the hand on the same side. So if you're digging into your left levator scap, take your left hand and just place it on your sacrum and find your tailbone. If your arm does this, might not. Now pop out your thumb, and wherever that space is between your hand and your thumb, that's your piriformis muscle. Okay. So the exercise that we're going to do today, typically when I'm treating clients or teaching them how to treat these places, I have them use fascial tools to apply pressure into these places. Specifically, what a set of tools that I have called RAD balls, R-A-D balls. You can look them up. There's a set of 3. It's $15 on Amazon, or if you go directly to the website, which is preferred, you can buy them there. RAD balls. It's a set of 3, and the first 2, I put one in that spot in the levator scap and the other in that spot in the piriformis, and we're going to lie face down. Now, since we don't have those tools today, I'm going to be guiding you with your hands instead. So remember where those 2 spots are. We're going to be switching to a lying down position, and I'm just going to have you put your hand sweetly and lovingly in those spots while I guide you through a meditation. That's going to be our practice today. All right, so a lot of surrender, trust, and feel. Before we begin, if you have the ability to, I'm going to ask you to stand now. Because there is an emotional component here, it's not just all physical. We're going to call those parts of ourselves back home that may have experienced a trauma related to having your truth stifled. And we don't need to know when, we don't need to know where, we don't need to know what. We're just going to surrender and trust. So if you have it in your body to stand with me for a moment, what that's going to do is it's going to get you away from the screen so that you can really just feel your own self. Once you're standing, I'll ask you to start to bring your hands to your belly. Take a slow breath in, feeling your belly rise. Slow breath out, feeling your belly fall. And for those who are caregivers of folks who cannot follow the physical cues today, I'm going to ask the caregiver, please put your hand on the belly of the person you're giving care to. And then you focus on your own breath. As you breathe in, your belly rises. As you breathe out, your belly falls. And what this does is it just brings the breath out of the neck and shoulders and down into the pelvis. We're teaching the body how to do less. Slow breath in as your belly rises. Slow breath out as your belly falls. As your belly rises, you breathe in and raise your eyebrows up to gently take the tension out of your eyes. And then as you breathe out, your belly falls and let your eyes relax. Gently retract your chin back. Pinch your shoulder blades together and tuck your pelvis under, wiggling your toes, bending your knees, bending your hips, and just sit back over your pelvic floor, over your heels a little more. This brings your energy away from me, away from the screen. Now you can feel more of you stacked up over your spine. Return back to your breath, feeling your hands over your belly button. Breathe in. Breathe out. Sit back. Breathe in. Breathe out. Breathe in. Breathe out. As we breathe in, we feel our hands pressing into our belly. As we breathe out, we feel our belly button come closer to our spine. Continue with this slow inhalation and exhalation as you begin to visualize a swirl of energy centering behind your belly button, between your belly button and your spine. The swirl of energy begins to expand, running counterclockwise to your body, down your left arm. Breathe in, breathe out. The swirl continues to expand until it fills your whole abdomen. As the swirl of energy expands, filling the middle of your body, a tube of light begins to run down your tailbone, connecting you to the earth. Breathe in, breathe out. Simultaneously, a tube of light begins to run up your spine, through your throat, the base of your skull, behind your eyes, and up through the top of your crown, connecting you to the sky. Breathe in, breathe out. As we expand these energy systems, we call all parts of ourselves home, past, present, and future. We invite in those younger parts of ourselves that have been challenged, who have had our truth stifled, or have experienced a stifling of truth. The body remembers. Now move your hands from your stomach up to the levator scap in that spot that I showed you. Go to the shoulder that's talking to you the most. Trust that's the right one. And then you're going to take your second hand and place it right next to the tailbone where we found the piriformis. Take a slow breath in, feel your belly rise. A slow breath out, feel your belly fall. Connecting again with that spiral of energy running behind your belly button, filling your abdomen, running down your tailbone and up your spine. From this place, staying at your center, we're going to slowly begin to move either back to your seat, or I invite you to lie down if you can. And again, if you are the caregiver of someone who cannot do this, I strongly encourage you to touch those places in your client's body and trust that the energy will run through you to them. You're not going to take it on. So join me in either a lying down position or a seated position if you don't have access to a chair. A bed. Take a slow breath in, raise your eyebrows up. Slow breath out, relax your eyebrows down, and then bring your hand back to those two places. If you are lying down, you can just wedge your hand underneath you a little bit. You don't have to turn your palm up and cup. You can just keep it and just put it behind you, and maybe even make a little fist if you don't have too much pain in your hand, or cup your hand a little bit just so that you can feel some pressure into that piriformis, just enough to connect with that place in the body. So what makes this work so special and unique is that we're telling the body, I see you, I feel you, I'm listening. It's like a body worker pressing there, but it's you. And then with your hand, same thing. If you have this in your ability, if there's not too much pain in your hand, just kind of curl your fingers under a little into your shoulder. Feel that input. Body's like, oh, they're listening. You can, for this, if you're lying, please keep your knees bent and your feet flat. That pops the piriformis muscle out a little bit more, but you can let your knees fall in towards each other. Take a slow breath in, raise your eyebrows up. A slow breath out, relax your eyebrows down, coming back to that intention that we set to call all parts of us home. Feeling your belly rise and fall. Feeling the gentle pressure of your hand touching an ancient place in your body that holds the memory. With all of your intention, begin to connect your awareness to the warmth and the pressure of these two hands. Feeling those two spaces connect to one another. The piriformis and the levator scap meeting each other like old friends, remembering that they have one another, that they're not operating in isolation. They don't have to do it alone. Breathe into any place in your body you might be holding tension, recognizing those are the garters, those guarding parts, those gatekeeper parts. Oh, we love those parts too. Breathe between the eyes, the jaw, the throat, the belly, the hip flexors, feet. Oh, we hold so much in our feet. And then come back to the warmth and the pressure of your two hands. Begin to get very quiet with yourself here. Feeling any subtle sensation between the two spaces. Where can you let go? Send your breath into the fascia between your two hands. Feel your neck soften. Feel an activation deep in your pelvis. When your mind wanders, go back to what am I feeling? As you breathe, allow your neck to move, to make space for the tissue to unravel around your throat, feeling how it connects down to the pelvis. This unconscious connection exists whether we recognize it or not. Use your breath. Make space. Allow the emotion to quietly dissolve. Energy now flows as the fascia flows. One or two big breaths. Allow sound to come with this one especially. Feel the emotion behind it. Slowly begin to take your hands off. If you're lying down, roll to one side and push yourself up to sit. Before we end, we're just going to take a moment, bring your hands together in gratitude. Slow breath in, raise your eyebrows up. Slow breath out, relax your eyebrows down. Sit back over your pelvic floor like you did when you were standing. Thank you to the parts of us that kept us safe and held this for so long in our systems. We now ask that this fully releases and integrates over the following few days. Don't be surprised if you have thoughts that come up from this. Journal. Show the body you're listening. Thank you, thank you, thank you. Thank you all.
Thank you, Nyle, so much. Unfortunately, I think we lost Janette, so I don't know who's doing what next week. But Nyle, can you put your link over in the chat for folks? Because it looks like there's multiple. There's a question where you are, so great. And with that, I'm gonna actually stop recording.